Hello, and welcome to the 2025 Advocacy Video Series presented by the Nevada Minority Health and Equity Coalition. My name is Alicia Love, and I am a graduate level student intern in the MSW program at UNR. This series is intended to bring light to the impact of recent changes and challenges in the public health and social services space, as well as getting to the heart of why we continue to serve those in need and to inspire hope in the community as we resiliently navigate these changes and challenges. Today we have with us Dr. Joanne Leovy, a family physician with over 30 years of broad spectrum primary care practice experience. Dr. Leovy is the chair of the Nevada Clinicians for Climate Action, where she works in coalition to educate and advocate for measures to reduce the impacts of climate change on health. She also volunteers as the Nevada State Co-Coordinator for Citizens Climate Lobby, a nonprofit, nonpartisan, grassroots advocacy climate change organization focused on national policies to address the national and global climate crisis. Thank you so much for meeting with me today. Can you please tell me your story, how you got into this field, and what inspired you to do what you do?
Well, hi, Alicia. Thanks so much for inviting me to be with you today. As you mentioned, I'm a family doctor and I have had a wonderful career. Um, there are several things that I love about being a family doctor, but probably most among them is the ability to have long-term relationships with individual people, to be present at important moments in their life, and to help them on a journey to better health. And I have loved that work. But it's also true that that work is with individuals one at a time. And so I think that opportunities in the public health sphere are so appealing because you have the chance to impact many people's health at one time. So, how I got into climate change work is actually a really long story. My father was a meteorologist, and he started talking about global warming way back when I was growing up in the 1980s, even. And I kind of put that aside and in the back of my brain. And when I moved to Las Vegas in 2001 from a place that was much cooler and much greener, I realized immediately that sustainability is a big, big issue here. And the thoughts about having enough water and a healthy environment really became more front and center. As time has gone on since then, and we've begun to realize all the impacts that climate change has in terms of disasters and extreme heat and air quality concerns and many other things, I've become more and more concerned about that. And so that led me over time to do some volunteering with environmental groups and organizations that eventually led me to Citizens Climate Lobby. For many, many years, I did my professional job as a doctor completely separate from my climate advocacy volunteer work. Um, but then, we used to think about climate change more as an environmental problem, which it's true, that's what it is. We used to think about the Arctic and polar bears. But in recent years, it's become very obvious that it's really at its heart a human health problem, that it is probably the biggest risk to human health that we have. And many studies have confirmed that. There's an organization called The Lancet. It's a medical journal in Britain, and they write a lot about the human health concerns and about how working on climate change actually is an opportunity to improve health for large numbers of people. So as I became more aware of that, and as I began to realize that things like air pollution cause problems with so many parts of the body, with the lungs and the heart and the brain, neurologic system, with the immune system. I really understood that as a health professional, I have a voice in helping people to understand climate change impacts on health and to try to work toward making things better. So I learned about other doctors and other health professionals that are working on the intersection of climate change and health. I learned about an organization called the Medical Society Consortium on Climate and Health, and I decided I needed some extra training so that I was sure I knew what I was talking about. So I went and got a diploma in climate medicine, which is about a half a master's course. It's a series of 5 certificates all about the impacts of climate on health globally, locally, within our healthcare system. And that led me to start a state affiliate of the Medical Society Consortium called Nevada Clinicians of Climate Action. And we are going to celebrate our third birthday coming right up here. And so I've been working as a volunteer to try to engage health professionals that are concerned about climate and the environment, or that want to know how they can be more sustainable in their workplaces, and to engage members of the public to make sure we all understand what heat safety looks like and what disaster resilience looks like, and how we can ask our political leaders to do things to bring down greenhouse gas emissions and keep us all safer.
I do remember growing up and learning about climate change being about uh, polar bears and ice caps, and it being such a far removed issue compared to what it is now. Because, yeah, now it's very much a human issue and something that even everybody is experiencing on a day-to-day basis. Thank you for
Yeah.
sharing that story. It's very inspiring that you have uh, done so much and moved so far down this path for climate change advocacy. And it's really cool that you were able to marry your work as a physician with your advocacy in the way that you have, and that you've done such incredible things for this community here in Nevada.
Well, I think,
Um,
another aspect of that is that health professionals and public health professionals, and especially nurses and pharmacists, and also doctors and people in the public health field, we still carry a lot of trust with the public. You can think of us as trusted voices, and that's because we like to have our facts straight. We like to be sure of what we're saying. We like to listen to a variety of opinions, and so sometimes we can speak about climate change as an issue that is now, that's here, that's serious, and that's affecting us. And that allows people to think about the issue in a different way than they might reading something in the news media just about climate change, for example.
so we all know that there's been many recent policy changes around healthcare and the environment in the past year. I was wondering if you have been directly impacted, or the work you're doing has been directly impacted by any of those policy changes, and if you could tell me about that.
Yes, I think there are a couple of things. One is that we know that because of cuts coming to the Medicaid system, to health insurance, uh, overlaying what we have in Nevada already, which is a health profession shortage and a shortage of healthcare workers and available healthcare for people, that has really put our health system in a state of semi-crisis. And health facilities and people working in the system are really focused on how to continue to survive and how to continue to serve our patients. And so it's hard to have any bandwidth for things like making your office more sustainable. Now, I think you can marry those things too, because there are a lot of sustainability things that actually can save money, and that if we are working on a healthier environment, we will have healthier patients and we can better take care of healthier patients. So there are those connections, but it's been a difficult year in that way. And then, of course, we know that lots of federal grant funding has disappeared and dried up, that opportunities for us to work with people who are vulnerable in our communities are not getting funded. So we know that climate change is a global impact, but we also know that people are not impacted equally. We know that people who have housing vulnerability, people who live in homes that aren't well weatherized, or who have to work outside or go and walk outside, all of those people are much more susceptible to things like extreme heat and smoke from wildfires, which are being aggravated by climate change, that people with lower incomes aren't able to recover from climate-fueled disasters as well. And so that paying special attention to people with vulnerabilities actually is healthy for our society as a whole, but we are seeing decreased funding for that. I also think that there's been some amount of mm, people being a little bit afraid of the term climate change, thinking that it's too politicized or not wanting to stand out in these times. I'm proud that our organization has climate right in the name, and we're not thinking about changing that because climate action to me is a core thing that we have to do to have a better and healthier society. As a volunteer and as an organization working on very little money, it's had less impact for us than I think it might have had for other organizations that were getting a lot of funding that has since dried up.
So, do you anticipate any changes in the coming years that are going to impact you and the work that you do, or even the other physicians that are in your coalition?
Well, yes, I do anticipate changes. So there are a couple of things that we try to do. One is we try to advocate for reducing greenhouse gas emissions. And if you've been hearing any of the news out of the COP conference that's going on in Brazil right now, you will know that emissions haven't really declined globally and certainly not in this country. We have currently heavy pressure for increased electricity use, which is making it more difficult for renewables to replace fossil fuels. So I think that we have an ongoing and continuing fight to reduce greenhouse gas emissions on many fronts, and that landscape is constantly changing. I do think that in Nevada, we're in a good position to continue to make our electric grid cleaner, to continue to have lots of clean energy jobs, and to think carefully about what our environment actually can sustain here. So that's one thing. And then the other thing that we try to advocate for is better resilience. So that means making people and communities and our state in general hardened against the impacts of climate change that we're having. And we know that those impacts are going to get worse. We are going to have more extreme heat days. We are going to have more wildfires. It is highly likely that our serious drought down here in southern Nevada will continue. So we do anticipate that those impacts will continue to be more manifest and that we'll have to respond in terms of what policy solutions we think about promoting based on those impacts.
So, on the other side of the coin, do you have anything that you would like to share with other advocates to inspire hope? Maybe a good thing that's changed that you guys have experienced, or anything that you anticipate happening for good in the future?
Yes, I think, there's, for example, we'll take the issue of extreme heat. Nobody was really talking about it here in Nevada until just in the last few years. And now there's a huge coalition of elected leaders, people in various levels of government, academicians, and community-based organizations all working on how can we better respond to extreme heat. So that's an example of an issue that really had no work going on that's now got a lot of work going on. I also always get inspired by people I meet. Every day I meet new people who have concerns and who want to join the movement, lots of students who are really interested. This month at our monthly meeting, one of the University of Nevada, Las Vegas medical students is going to talk about plastics and health harms of plastics. And so just having people step up, and especially students and people starting in their careers step up is really great.
Right. And then is there anything that you do in your own personal life to help keep you motivated and to keep up hope in yourself?
Oh, yes. So I think, when we are advocates or when we're working on issues, it's really important to balance that and to um, try to figure out, what we're really in it for. And since, really I want a healthy and stable climate, I'm very interested in being outside and experiencing outdoor Nevada. I think it's a wonderful place. So I spend lots of time hiking and kayaking, and this weekend I'm going to go out and pick up a litter at a place where there's some ancient rock art and think about the ancient peoples who were living there. So that's one of the things that I enjoy doing. And then I think that, one of the beautiful things about kind of on my journey is initially I was kind of alone, or I was just with two or three people. We were trying to figure out, wow, we're worried about climate change, but we don't know what to do. But when you're in an organization with multiple people all working in the same direction, you have automatically a community of supportive friends. And to me, that keeps me hopeful. I know that there's lots of things happening, lots of technology, lots of new ideas, lots of possibilities. And so I think despite the fact that things have been difficult in the climate space this year, I still have hope in the long term that lots of good things can happen.
Thank you so much. I appreciate all of those points. I am excited to get outside myself since it's finally cooled off a little bit here in Vegas.
Yeah. And you're healthy this week, hopefully.
All right. Well, those are all the questions that I have for you today. So thank you so much for taking the time to meet with me. For those of you tuning in, thank you so much for hearing Dr. Leovy's story. Please like, subscribe, and share, and check out the other videos in this series. Thank you again.
Thank you so much. I appreciate it. Bye bye.